Good evening.
Good afternoon, everyone, and good morning to and good evening to our international participants joining us from various parts of the world. I welcome everybody to the World NCD Federation International Webinar Series on COVID-19 and NCDs. Today we'll be having our first webinar, which is on COVID-19 and the NCDs, its impact and the strategic approaches. This webinar is being supported by Upjohn, the Pfizer division. Today we would be having three speakers, and the three topics covered would be the impact and strategic approaches of COVID-19 and NCDs, building partnership for COVID-19 and NCDs, its way forward, and the role of the private sector in the industry partnership in NCDs. So for the first topic, I would introduce Professor J.S. Thakur, who is the professor of Department of Community Medicine and School of Public Health of PGI Chandigarh. He's also the founder president of the World NCD Federation since 2015. He is the member of Mission Steering Group of the National Health Mission at the highest policy making, Ministry of Health and Family Welfare. For COVID-19, he's a part of various setups, which includes the India COVID-19 expert group of Ministry of Health and Family Welfare, the team leader for the Chandigarh, constituted by Chandigarh for investigating written cases of COVID. The Also, he's the chairman for the COVID-19 Prevention and IC Committee constituted at PGI. He's the collaborator for Global Burden of Disease study by the University of Washington, and he's provided consultancy at international level to many developing countries, including Sri Lanka and Timor-Leste and various Indian states. He has more than 200 publications in peer-reviewed journals and has undertaken more than 50 international projects. Uh, I will hand over this webinar next to Dr. J.S. Thakur. Welcome, sir.
So thank you, Ria, for the liberal introduction. And on behalf of World Institute Federation, I welcome you all for the first webinar of International Webinar Series. I'll be speaking on COVID-19 and NCD, the impact and the strategic approaches. So during this presentation, okay. So during this presentation, I would like to little bit introduce the World NCD Federation and its key activities, the background and the timelines, COVID-19 and NCDs, impact of COVID-19 on NCDs, and then on SDGs, what are the strategic approaches available with us, and some of the material which we have developed over a period of time. As you might be aware that World NCD Federation is a professional association working for global NCD agenda launched in 2015. It's having its headquarters in Chandigarh in India. It has many publications, a book on public health approaches to non-communicable diseases. It published International Journal of Non-Communicable Diseases. There are 3 manuals in Hindi, Punjabi, and English. We organized World NCD Congress every 3 year, and first was in Chandigarh, which came up with the Chandigarh Call for Action on NCDs. And we also organize international NCD courses and international seminar CMEs uh, in the month of first week of March. Now, during this Corona time, most of the attention went to this disease and the pandemic which we all are experiencing. And World NCD Federation decided to come up with a special issue of Indian International Journal of Non-Communicable Diseases, which is the official publication of World NCD Federation on COVID-19 and NCDs. And eventually we decided that we should have a webinar series where we will be discussing what is there and eventually draw the attention of everyone to important aspect of NCD and COVID comorbidity. So this is the first webinar in the series, and eventually this will go on for full 1 year, and every month we will be having a webinar on a specific topic, also cover diabetes, cardiovascular diseases, cancer, and other NCDs. We also came during this year the World NCD Federation guidelines for NCD in the low and middle income countries. And in fact, these guidelines, they cover 9 diseases, that is type 2 diabetes, hypertension, cardiovascular diseases, chronic respiratory diseases, cancer, mental health disorders, stroke, chronic liver diseases, and in that, alcoholic liver diseases and non-alcoholic fatty liver diseases. And these are first of its guidelines, which are covering mainly the primary and secondary healthcare aspect. Because if we have strengthened primary and secondary healthcare, 80% of the non-communicable diseases, they can be taken care at this level. We are also coming up, we have also started the Center of Excellence for Evidence-Based Research for NCD in LMIC. And already we have started 3 RCTs. One was which have the one on community health workers for NCD prevention has already been completed, and this effectiveness of targeted intervention and effectiveness of mass media intervention in NCDs, their protocols are already published. And now we are further strengthening this Center for Excellence for Evidence-Based Research by having some collaborative arrangement with the Pfizer. Now, the second World NCD Congress is being organized in University of Michigan. It was supposed to be during August in this year, but unfortunately, due to this pandemic, it has to be shifted to next year in July 2020. And now the theme for this is prevention of chronic diseases, learning health systems, and learning healthy communities. So we will be, doing this most probably as a hybrid conference. And we also organize this international course on public health approaches to non-communicable diseases. The sixth edition was supposed to be done during this year, but we are now doing the sixth edition in the March next year from 2nd to 7th of March. This course is quite popular and is subscribed globally. We get students from all over the world for this course. Now, coming specifically to the World NCD Federation International Webinar Series on COVID-19 and NCDs, the theme is COVID-19 and NCDs, and the today's session is on COVID-19 and non-communicable diseases. What is its impact and strategic approaches? I'm happy to share that we have this Upjohn Pfizer, which is now Viatris, as a partner with us also. I think all of us know about the timelines of spread of COVID-19. I need not to go into more detail, but you all know that this started in December, and eventually on 3rd January, India notified by WHO and the on, the these are some of the milestones which are, there. But on March 11, the WHO declared COVID-19 as pandemic affecting all continent of the world. Now, just to little bit about, the COVID-19, the host factor, it affects, we know, all age groups and gender, and older age people and people with chronic diseases, hypertension, diabetes, COPDs, cardiovascular diseases, cancers are more factored. And that's why we are going to have this specific webinar series dedicated to non-communicable diseases. There are certain environmental factors, temperature, humidity, which are not yet very clear. So we are, over a period of time, we are adding to the knowledge of the natural history and epidemiology of this disease. Now, if we see the global versus India stat, we will find that, the COVID-19 is responsible for substantial morbidity and mortality at the global level. And if we take the example of India, it is responsible for 18% of the total deaths which are occurring in the country. And if we see that what is the proportion of these death where the comorbidity due to NCD or is there, it is almost 70 to 80%. We come from a state which is Punjab state, where it has been found that 80% of the deaths among the COVID patient are among those who are suffering from chronic non-communicable diseases. Now, so if we see the impact of COVID-19 on NCD resources, this is the WHO data for different regions of the world. And these figures shows the percentage of countries with the Ministry of Health staff with the responsibility of NCDs and their risk factor being reassigned, deployed to, help with the COVID-19 response. In fact, most of the program officer all over the country is working in the NCDs. They are reassigned to work in the COVID-19. And if you see the figures, this red is, yes, all staff supporting COVID-19 effort in full time. You will see that particularly in the European and Southeast Asia region, you will find mostly NCD staff is reassigned. This dark yellow color is all staff partially supporting. So you will find that in many countries and all over the regions, this is the situation. And so you can see that this COVID has diverted the attention of the staff from the NCD pandemic, which is also a pandemic of our time. So it has badly affected the availability of the human resources. Now, if you see this another percentage of country reporting disruption of NCD related services, so you will find that, almost all type of services for NCD, starting from rehabilitation services, hypertension management, diabetic and diabetic complication management, asthma services, palliative services, cancer treatment, they are disrupted. Somewhere it is completely and almost partially to the extent of 60 to 70%, which is really a matter of concern, because we know that NCD require regular treatment, regular follow-up, which is very, very important. This slide shows the percentage of countries reporting disruption to the Ministry of Health NCD activities planned for the current year by WHO region. And here you will also find that Ministry of Health attention in most of the countries is for COVID pandemic, and it has serious impact, particularly on implementation of NCD services the public health screening program for NCDs, WHO package for essential NCD interventions, WHO heart technical package. So all type of services in the ministries has also adversely affected due to this. Now, impact on prevention and control of NCDs. As we have discussed, that prevention and control of NCD is important during the pandemic because of high mortality due to NCDs. So there are restrictive measures such as lockdown, social distancing, and restriction. They have really impacted the physical activity and the dietary aspect. The disruption of the routine health services and medical supplies also lead to medical morbidity, disability, and avoidable mortality. Without proper management, chronic disease can worsen, and this is what has happened during this period. I mean, if we do the analysis of COVID death versus the other deaths, I think many people they have died due to the non-COVID related mortality also during this period because they do not have the access to the services. Now, if we see what is the going to be the impact of this COVID pandemic on sustainable development goals, which we need to achieve by 2030, so it has been found that it has unprecedented effect, and you know, we most of the countries they were not prepared for this type of emergency. So, major economic challenge during this COVID-19 is high out-of-pocket expenditure, particularly in developing countries, and increased out-of-pocket is associated with subsequent poverty, unemployment, other socio-economic consequences which may affect individual and the population, and thereby are marched towards SDGs. And COVID may slow the progress of on SDGs on even further, and there are estimates that we may push our target of 2030 to maybe 2 decades later. So there is going to be a serious impact on sustainable development goals. Despite the considerable progress made in prevention and treatment of NCDs, the momentum of the change has dwindled, and I would say I have no hesitation in saying that this SDG target of 3.4, that is reducing the premature mortality due to NCD to one third, is practically off track, and we really need to bring it on track. COVID-19 pandemic has become an amplifier for the health system to better respond to NCD. So this challenge is also an opportunity, and we should also see that how we can uh, take this challenge which was proposed by the COVID-19 as an opportunity to improve the delivery of services. Now, if we see the what are the challenge, risk, and priorities for NCD during this COVID-19, most of us were having increased indoor time, and what has happened? It has the decreased our physical activity and increased the mental health issues. And so, specific priorities here should be use of technologies to provide knowledge or management, online or e-sources for information on exercise, mental health, and management issues. So some of the helplines, especially on mental health issues, has been started. Secondly, inadequate access to the medicines, and it has led to the inability to access the essential medicine or shortage of supplies of these, such as insulin or any specific drugs during this period. And most of the institutions, including my institution, is providing now the technical telemedicine consultations and through the telemedicine network which is available in my institution. Due to travel or transport restrictions, there are restricted transport facilities and support for continued NCD care. So we have to see that how we can prioritize and ensure continued community level services they cater. And this also make a case that we really need to strengthen our primary and secondary care so that people do not have to rush to the hospital. Early detection and laboratory testing. NCD patient for whom visit to health facilities are essential could be a greater risk of getting exposed to COVID. There are many healthcare workers, patients who have contracted, the COVID-19 while visiting the health facilities. So, we have to prioritize NCD patient for COVID-19 testing, and we have to see that they do not become victim to this. Contact tracing, NCD patient might be unaware of the additional risk posed on them. So focus especially on those with the increased risk factors. So due to the increased susceptibility to the infection in the healthcare setting, NCD patients with comorbidities are at the increased risk of infections. And we should try to provide NCD patient and the healthcare staff working with the special training so that healthcare professional and healthcare workers they can protect themselves. This is one strategic framework which we have advocated for India. It is published in International Journal of Non-Communicable Diseases. And in any response, it is very important that we need partnership, which you are going to hear from the subsequent two speakers. That is from public sector, private sector, non-governmental organization, research and academic and community participation. And we really need a health system response with the National Health Mission and the state health missions, evidence generation, priority setting, and integration with the other ongoing program is very important. We really need to have guidelines for comorbidities, especially COVID-19 and NCD, and of course, this capacity building is very very important for the health workforce, that how to deal with the situation. And most of the national discharge disaster authorities are also activated, so multi-sectoral participation is in place and can also be leveraged to address the issue of this cohort. So there are many strategic approaches, but some of them I would like to highlight. That health system strengthening is very critical. Additional workforce and infrastructure is required because people are more now, reassigned to the communicable diseases, access and delivery of quality healthcare, and also evidence generation for evidence-based guidelines, which World Density Federation is also now implementing and try to incorporate in the national health systems. Uh, we really need to have integration within the health sector, and there are very few models, but we have to learn that how to address NCDs during this period. And so priority setting is required, convergence with the various social development programs, as well as the various other NCD related program is required. And we really need to continue and strengthen focus on NCD prevention and management. Now, WHO has given some tips for people living with or affected by NCDs. That is, they should continue to take medication, follow medical advice, clear 1 month supply of medicines, and keep a distance uh, of at least 1 meter. Wash your hands with soap and water, quit smoking, and avoid using coping strategies, safeguard your mental health. So all these issues are very very important. Sorry, little bit disturbance in the impact of the slide. I am coming to the summary. Just to summarize my presentation, COVID-19 has critically impacted the global health system, NCD pandemic, economies both in the developed and developing world, and is associated with two concurrent global health crisis as well as economic crisis, which all of us are facing. So we need appropriate policy response, and we'll see that how this policy response will impact the pandemic, the human health and economic well-being. Addressing NCD is crucial for health as well as sustainable development and essential to assess the prevalent gap. Mobilization of resources are required for evidence-based policy making. Of course, the strengthening of health system is very important, particularly health system financing and effective partnership for addressing the health disparities and inequities, which are further aggravated by this COVID-19 pandemic. We have tried to develop some of the material, health education material, which is available uh, in the World Density Federation site. In my institute, we have also developed a portal which is now called COVID-19 portal. There are many videos on critical health issues, mental health, NCDs, and also we have come up with a lot of health education material in English, Hindi, and also some information booklet in English, Hindi, frequently asked questions. So this resource material, we are still working on it. In India, our Prime Minister has started a, Jan Andolan. I have the opportunity to chair this, the coordination committee of this Andolan in my institute. But we really need to work a lot. And during this challenge, I think we really need to work to change it into a opportunity that how we can address the issue of non-communicable diseases. These are some of our forthcoming activities we have mentioned here, as I mentioned. So our international NCD course will be available in March. Next year, our World NCD Congress is there. We have Professor Mukesh Kapila, who is there in the our European region as the regional coordinator. So this was a challenging time for all of the regions of the World NCD Federation. However, we will come out of this, pandemic also, as we have dealt with others. I'm very optimistic about this. So thank you very much for your patience here.
Thank you so much, sir, for the enriching talk. For the next topic, we have Professor Mukesh Kapila, who would be talking on the partnership of COVID-19, partnership in the times of COVID-19 and NCDs, its way forward. Dr. Mukesh Kapila is a professor of global health and humanitarian affairs, University of Manchester. He's also the senior advisor to the Parliamentary Assembly of Mediterranean. He's a writer, public and media speaker, has an extensive experience in global health, humanitarian affairs, conflict and security, international development, human rights and diplomacy. He also has his qualifications in medicine, public health, and the development from the universities of Oxford and London. He is also the Regional Counselor for World NCD Federation of the European region. He serves as an advisor on several international bodies, including the Strategic and Technical Advisory Group for Antimicrobial Resistance for World Health Organization, has served as a senior leadership functions in the UK government, the Department of International Development, United Nations, WHO, and the International Federation of Red Cross and Red Crescent Societies. He has many awards to his name, including the CBE from Queen Elizabeth and the Global Citizenship Award of the Institute of Global Leadership. Welcome, Dr. Mukesh Kapila.
Thank you. Can you hear me?
Yes, we can.
Okay, thank you. Very good to see you, Ria, and my friends, Professor Thakur and other friends. And I am missing Chandigarh, and I hope that one day I will return there also. Now, my topic is to talk about partnerships. Firstly, let me react to Professor Thakur's comments by saying that, to be honest, many of the side effects of the response to the coronavirus have been self-induced. So it's important to look at what has happened in the last few months. What we have seen, and I speak from the perspective of low and middle income countries, even though, of course, I live in a developed country, a so-called developed country, upper income country. The point is that while COVID has caused a lot of disruption, many of the consequences of that disruption could have been avoided. And the thoughtless way in which many public health interventions were instituted by low and middle income countries, simply copying what was done in China or copying what was done in the Western world, have actually made problems worse. They spread the virus, and in fact, the economic and social consequences of the virus far exceeded whatever the biomedical consequences were. And I think the data are emerging that deaths from non-COVID causes are exceeding COVID causes. So a degree of humility is required in this particular business, which brings me to my second point, and that is, at the moment when partnerships were needed most, at the moment when the values and principles of working together and solidarity and partnerships were needed, we had the opposite. So why should there be now partnerships between COVID and NCDs? Because at the moment when partnerships were needed, people were betrayed. Public health strategies betrayed it, institutions betrayed it. And so just because partnership is a good thing, doesn't automatically follow that building partnerships between COVID work and NCD work is necessarily a good thing to do. So I'm saying this in a somewhat provocatively because it's easy to say, let us have comprehensive health systems, let us strengthen our health system, let's strengthen primary health care, and so on and so forth. But the reality is that at the moment when these things were needed, they failed. What is the point of strengthening health systems that failed at the moment of greatest need? So I just want us to kind of think about this rather than in a knee-jerk way, simply repeat the same old prescriptions that have actually meant that we have the worst impacts of the pandemic have been on the poorest and most vulnerable people around the world. And I see this impact in the poorer areas of India, but at least from a distance I see it. And I also certainly see it in Africa, and I've been working a bit on COVID in Africa. So let us think a little bit more and not so superficially. First, but let me start actually from today's news. Today, we've learned that the UK has become the first country in the world to, the regulatory authorities in the UK have approved the Pfizer vaccine. And what that means is that we are now living in the vaccine age. So the first question is whether or not a partnerships between NCD work and vaccination work is going to be good or bad for public health. The problem we have with NCDs is that it's 70% of world mortality, morbidity, and such like. When you have an overwhelming burden of disease caused by one category of diseases, it's very difficult to prioritize it, because on one hand, it is the greatest contributor to the burden of disease. And yet we know that when we're going to do vaccinations, it's going to be very, very difficult to be able to prioritize 70% of the population. You might as well prioritize everyone. So it's not instinctively the most effective strategy to build a partnership around vaccination between NCD work and vaccination work. This will depend on the context. This will depend, for example, on the state of service delivery. In those countries where vaccination services are well established and where there is good collaboration in relation to existing vaccination services, it may well be that integrating COVID vaccination into that system will be a very good thing to do. However, this does depend on the vaccine that's adopted. A vaccine that requires storing at minus 70 Celsius and very complicated logistics may not be the most appropriate way of running vaccination services through partnerships that build on existing services. I don't know. So I think the important thing in thinking about partnerships is not to automatically jump onto the bandwagon to say that partnerships are a good thing. Partnerships are only good if they deliver a public health benefit with the time, resources, and realistic infrastructure that is available in a particular country. And it is not for me to say what India should do or to tell any other country, but it's very, very important that the health system and public health authorities realistic view of what is going to be possible. We know, for example, that it's going to take at least a year or more for herd immunity to be achieved through vaccination approaches. In other words, at least 60 to 70% of the population has to be vaccinated, and this isn't going to happen. This is not going to happen tomorrow. So it may well be that verticalized programs are going to be much better at reaching the maximum number of people. And obviously, in that approach, people with chronic diseases should be prioritized, as should healthcare workers and such like. So this is about hard strategies being taken in a ruthless manner, rather than partnerships being built or system to be strengthened from generic principles alone. And it may well be, by the way, in the case of low and middle income countries like India, is to not rush into vaccinations straight away. It may well be, and this is something that I've also been saying here in Europe, is that it may well be that it's better to wait for other vaccines to emerge, which are logistically less challenging, than to panic and buy the first vaccine that's available on the market. But that's another debate. Now, the other consideration in building a partnership is about whether or not is about prioritization. It may well be that the best way to go back to the status quo ante, where we were making progress on NCDs, is not to revive NCD services, which have been disrupted anyway, as Professor Thakur has just told us with compelling data from all over the world, but actually to put even more resources into COVID services and deprioritize other services, because that's already happened anyway. And it's much better to continue with that strategy of deprioritization. It wasn't a strategy, it happened because of public health policies which actually created inequalities rather than dealing with those inequalities. But now we are there. Now it might be better that we actually should put all our resources into getting COVID under control through maximizing vaccination services and including purchasing and laying them out through whatever means available. Because the sooner we can get herd immunity for the coronavirus and maybe target that to be achieved by the end of 2021 or by the middle of 2022, then the sooner we will get back to the status quo ante and get back to making progress on NCDs and on SDGs. Do you see the provocative point I'm making? It may well be that with the failures we already have got in the last 9-10 months of public health approaches towards COVID control, it may be that we have no choice but to actually continue with that approach and maximize getting rid of the pandemic through pursuing herd immunity. And obviously in doing that, we should prioritize people with chronic diseases and older people who obviously are epidemiologically and clinically much more vulnerable, as is now well established. So let me conclude here by saying, also making another point before I conclude, and that is, we are still going to need prevention and treatment services for NCDs, even if vaccination services are very effective in trying to build the herd immunity. But then let's look at the situation. Certainly in many of the countries that I have been dealing with, even soap is not available. So how can we actually talk about partnerships when actually the basic commodities like soap are not available in terms of maintaining personal hygiene? And it may well be that verticalized programs and ensuring that basic commodities, whether it is soap, whether it is a simple antihypertensive medication or diabetes medication, is made available in a verticalized manner. So really, I want to challenge us by saying that while I believe in strengthening health systems wholeheartedly, this is the way I've always been brought up. This is the philosophy I have pursued in all my work, including at the World Health Organization. The problem is that health systems are not going to be built that quickly. It may well be that a philosophy of universal health coverage, and I emphasize the word philosophy, is a much better approach to achieving healthcare coverage than it is to focus on health systems. Why? Because a philosophy of promoting universal health coverage does not rely in bureaucracies of health institutions, which by and large have failed and are failing all around the world. Why should we put more resources in health system institutions which actually are failing people around the world in terms of access, availability, and affordability? And we see around and around again that while governments are supportive of the rhetoric around health systems, the problem is that universal health coverage, if it becomes totally reliant on building health systems, we're not actually going to achieve the coverage of healthcare that is necessary. So it may well be that different approaches to universal health coverage are required than to focus on health systems alone. It may be that time will come when we are mature enough, rich enough, and we have less corrupt institutions, stronger governance around the world, where we might really begin to have faith in health systems alone and to sustain universal health coverage. But the way I see around the world, partnerships around universal health coverage which will require approaching it at a community level, which will require approaching it in terms of a multiple ways of working, and not necessarily systematic bureaucratic ways of working, are much more likely to bring us back to the path of achieving the health goals which are within the SDGs. Now, all this, I think, requires us to reflect much more critically on the nature of the appropriate partnerships we need to ensure that poor people get the care that they need in terms of health and social welfare. Thank you.
Thank you, Professor Kapila, for such an insightful perspective. The next speaker, we have Dr. Chandrasekhar Potkar, who would be speaking on the role of private sector and industrial partnership in NCDs. Dr. Chandrasekhar Potkar is the Regional Chief Medical Officer, Growth Markets and Head Global NCD Excellence Viatris, and is responsible for the medical organization in growth markets and setting up of the medical and scientific strategy in Viatris across Asia, Africa, Middle East, Eastern European, and the Latin America regions. Previously, he was the Regional Medical Affairs Lead APAC for Pfizer's Essential Health business, where he led the medical team across the region and provided strategic medical support. He has over 26 years of professional experience as a pharmaceutical physician and has taken up on leadership roles of increasing responsibilities and medical affair function in various emerging markets. He has an extensive experience in setting up startups and leading service delivery research and medical organizations, as well as leading teams across the product life cycle. He has conceptualized and led innovative initiatives across emerging markets to drive growth, medical partnerships, and efficiency. Welcome, Dr. Chandrasekhar Potkar.
Thank you, Ria. And can I share my screen? I have a couple of slides that I would like to. I hope you can see my screen.
Yes.
Yes. Yeah. Okay.
Yes.
Perfect. Thank you very much. Thank you, Dr. Thakur and Professor Kapila. Thank you for the invitation for this inaugural webinar series. This is very timely as we are approaching practically a year milestone during this pandemic. And this allows us to really reflect back what has happened during the course of the year to hopefully shape our futures going forward. And it was particularly very stimulating and very provocative conversations, both from Professor Kapila as well as Dr. Thakur. So really what I'm looking at sharing with you is the role from the private sector, the industry perspective on what industry can do or is essentially looking at contributing to from the NCD COVID interplay that we are seeing. So I have a couple of slides just from framing the conversation's perspective. I do not really want to share any more data. I think we have already very familiar with the impact of COVID across low and middle income countries. Essentially, we are sharing a substantial part of the caseload across emerging economies and mortality. We know amongst the top countries, we do have India and Latin America featuring very, as well as African countries featuring very promptly in the top countries with the caseload. And we have also talked extensively about the disruption of the NCD services. For us, we are looking at from a take-home impact on non-communicable disease perspective. There are three areas or three themes which emerge. One is the baseline gaps that have been aggravated. We're looking at increase in the risk factors because of the pandemic mitigation measures. And we are also looking at the aftershocks because of the complicated NCDs. And essentially what Dr. Thakur mentioned was potentially reversing all the progress which has been done over the last couple of decades on sustainable development goals. So when we look at how do we frame what industry can do, essentially this is the framework that we are looking at from the industry perspective. How do we reimagine and leapfrog what we learned in last 1 year from impact on NCD's perspective? This is beyond our traditional role that industry plays and which we are very proud of in terms of developing new prevention vaccines or therapeutics. And we have example just as of today, the vaccine getting approved by the UK. But beyond the innovations, there are at least three other broad themes which we want to really bring out. Is one is the new patient journey, because of all the changes which we have witnessed over last 1 year, the new physician journey, and what kind of policies that we need to leapfrog. So just to quickly highlight some of the emerging pointers here from the new patient journey, we look at substantial opportunities around the technology, the digital part, which is really bringing out the solutions beyond the pill. And how do we leverage technology for influencing the patient journey from an NCD patient's perspective? When we look at the physician journey, definitely there is an increased reliance on telehealth and the use of connected health as such, reliance on technology, again, on education, and the need for real world evidence for us to really document the kind of impact that we are witnessing, along with the comorbidities, the risk factors, and the overall NCDs at large. And finally, if you look at the NCD policies, we are really, again, looking at the 2 or 3 different areas around primary care capacity, looking at the inequities which have been very clearly exposed during this course, especially in low and middle income countries. And finally, the NCDs as a silent pandemic, given the significant center stage that health has occupied during the course of 1 year of pandemic. Ironically, there is an opportunity for us to really see how do we utilize this center stage for positioning NCDs as a silent pandemic from shaping policies perspective. So this is a frame that we have been looking at: physician journey, patient journey, and the NCD policies, and with a very clear understanding that no one stakeholder can do it alone. So we will need collaborations, and I'm fully mindful of Professor Kapila's very provocative and stimulating conversation that the partnerships failed when it was very much necessary. But here we are really talking about some of these local solutions which might be needed, and where we might need to involve some of the stakeholders. So just one more slide that I want to leave you with is we started plotting the data gaps around NCD patient journey. Over the course of last several months, what we have done is the 5-step patient journey from awareness, screening, diagnosis, treatment, and adherence for each of the core NCD areas, whether it is hypertension, dyslipidemia, pain, depression, each of these core disease areas. What we have tried to do as a part of Upjohn Viatris, we collaborated in some of our key emerging economies, say Malaysia, Brazil, Mexico, Egypt, and so on and so forth. We tried to see what are the data gaps that we have, and what is the impact of COVID because of this pandemic on this NCD patient journey. And that has been quite useful synthesis of data that we have now got with the help of some of the physicians and other patient organizations, as well as pharmacist organizations that we have been able to compile. And what are we doing about it? There are a number of initiatives that we are really looking at from health promotion perspective, risk assessment to enhance the screening, looking at primary care in models in collaboration with primary care physicians, retail pharmacists, nurses in select countries, and also how do we improve the adherence from adherence pilots perspective. So these are some of the examples that we are piloting across. These are kind of models, but the key point to emphasize here is that the NCD patient journey is a very useful frame for us to consider what is needed at the country level, what the solution which might be or the impact that we might witness because of pandemic in Malaysia might be very different than what we might be seeing in Brazil versus in Egypt. So the solution has to be evidence-based, and the solution needs to be completely local. So that is where we are finding the NCD patient journey as a very useful tool. And our approach in a collaborative manner is completely local. And that's what we are trying to really do. So this is a quick snapshot of what the industry view and industry approach has been, especially from Abjo and Beatrice's perspective that I represent. But happy to discuss further and see if there are any questions or any points of discussion. So I'll stop here.
Thank you so much, Dr. Potkar, for your presentation. Also, now we will have a question. We'll take up those questions because we have many questions. Professor Thakur will be taking up some of those questions which we have received over the whole of the duration of the webinar.
So thank you very much to all the co-speakers, and I think they were all stimulating talks, and this is reflected from the number of questions which we have got. So there are certain comments, but there are some questions also. One, Professor Sunila Garg from New Delhi, she has asked that lab facilities are also not available during the COVID-19 times. Yes, madam, I mean, during this time, there was disruption of many services, including the lab services. So she's asking another question, that is there a case study where we have integrated NCDs with other areas like HIV, TB, RCH? So
Dr. Thakur, this is in connection with the WHO meeting I attended just day before. It was a 3 days consecutive meeting where we have to integrate NCDs with HIV, TB, RCH. Right now, health and wellness centers are talking about all of that. But, do we have a successful model of integration? To my mind, all these integrations, they get disrupted when we are faced with a situation like this, whether it is a pandemic time or a non-pandemic time. We have also seen during polio times also, all our routine immunizations were compromised, and we were only taking into consideration the pulse polio vaccines. So that's where I think somewhere the system has got to be that the essential services like NCD services should not suffer. And to my mind, it would have been better that SARI clinics or ILI clinics, when they recorded the oxygen and all that, simultaneously, they could have recorded, the random blood sugar or, blood pressure, so that, patient died of NCDs, they did not die more because of COVID, which you have already amply brought out. All the speakers have very clearly brought out this whole thing. So that's where I feel that it is very much important to set up very, strict SOPs where we do not diverge from that. And we ask the workers that, okay, this is what you've done for this, and this is what we need to do on an ongoing basis. Because where on one hand, we are talking of all the, broad factors. So it is important to look at this part also. I was audible?
Yes, you were audible.
Yes,
so anybody among the speaker, Professor Kapila, would you like to respond or? Okay. Please unmute yourself.
Oh, okay, sorry. Can you hear me?
Yes, please.
Yes, there are successful examples of NCD and TB, etc. integrations in Central Asia, where in fact the way NCD programs have been advanced have been to build on the back of TB and HIV programs, which have a long history going back. The problem is, the issue is not that integration is not a good idea. I think integration is a great idea and it does work. It reduces the burden on limited facilities, if you like. But the difficulty happens when you have a crisis. And that's when, quite honestly, having spent 20, 30 years working on crises, including health crises, the only way to deal with a crisis very often is a verticalized approach. And the problem with that, of course, is that while you're dealing with a crisis, someone suffers. So it's not an equal sum, it's not a win-win game. And that's the problem. And this is because of the way in which crisis systems exist. that it makes it very, very difficult to pursue the philosophy of integration in the middle of a crisis. So the only way to deal with that is not to panic. And I think what's happened in the case of COVID is that policymakers, including politicians, including public health people, they're panicked and they created a crisis and therefore that generated its own logic rather than necessarily, what should have happened. And you know what happened in India and elsewhere. So, yeah.
Yes, so thank you very much, Professor Kapila. In fact, madam, there is a case study from Kerala also. Kerala is one state which has a state palliative care policy.
Yeah.
And, and they are implementing it under the National Health Mission of India.
Yeah.
Here they have integrated the services like HIV, TB, stroke, NCDs,
Yeah.
and even the elderly care, and also linked it with the livelihood programs.
And with mental health also. Yeah.
Yes. So there are, case studies, and as Professor Kapila also during his presentation mentioned that, the issue is of universal health coverage right now, and integration and convergence is, needed in the era where we have, resources crunch all over the world. So
I will leave you with one question only. That is that, we should have a COVID death surveillance response, which will tell you exactly, as to people did not die of COVID, but they died because of uncontrolled NCDs. So, that will be a strong case, where we can talk of, that management of NCDs, even in crisis, becomes very, very important, because this is one of the issues. And something like when we are now harping with MDR, TB, and we are not going to meet that target as well. You rightly said that our SDG targets are going to be pushed by 2 decades or something like that. So I feel that we should look at those issues as well. Thank you so much. Thank you.
So there is a comment from Dr. Palash from Bangladesh that control of NCD help to control COVID-19. A comment, please. So anybody would like to respond to this?
Well, I think as you yourself have said, obviously the comorbidity of NCDs enhances vulnerability to the coronavirus that causes COVID, and people who have NCDs have higher mortality. That's well established around the world. The problem, I think, is that the way the coronavirus spreads is that I do not think that controlling NCDs alone stops the spread of the virus. It may well be. So it's very important to distinguish the two. Of course, by controlling NCDs, meaning having proper blood sugar control, proper hypertension control, etc., naturally a person who catches the coronavirus will hopefully not suffer the extreme consequences of progressing to COVID. That's well established. But the other way around is not quite clear. Because the way the virus spreads, it will just spread whether or not you have got NCDs. And in public health spread terms, I don't think that makes much difference in a way. So this is why it's important to both focus on NCD management for its own sake and on stopping the spread of coronavirus for its own sake. It potentiates each other, but I don't think there's a trade-off between the two.
Right, thank you. So there is a question from Professor Vinay Bhardwaj from Shimla. He says in India, the herd immunity will be beneficial rather than the delay in the COVID-19 vaccine. So, Dr. Shekhar, would you like to comment on this? So I think Dr. Shekhar has gone. So uh, yes, Dr. Shekhar, I mean, are you available? So anyway, I mean, the government is also trying in India that the vaccine should be made available as soon as possible. You might have seen that the Serum Institute of India is also saying that they are very near to launching of their vaccine, right? So of course, we have to see that what is the evidence available for herd immunity. There are some sero surveys which has been done in the country, but how this herd immunity is going to protect our population, and herd immunity may be useful especially for your younger population, but as Professor Kapila was mentioning, especially for elderly and people with comorbidity, it is very important that they should take adequate precautions. There are certain comments which are there leading to this is leading to a social crisis also. I think it has been amply highlighted. And the another comment is that partnership has to be need based and sustainable. Yes, I mean, that is very important, and it has to be sustainable. And there is another comment that people are not taking, the implications seriously, and therefore the governments are forced to enforce law or the lockdown again. So, any comment from Professor Kapila before we close this?
Well, I think certainly partnerships needs to be needs-based and sustainable. And the question then becomes how to make them sustainable. And there, one has to take a very hard-headed approach. They're only sustainable as long as there is a win-win and as long as the needs and the benefits continue. Otherwise, I think there is no need for partnerships. So, in the end, the virus is not looking for a partnership. Neither is your high blood sugar looking for partnership. Partnership is just a tool. And it is not by itself, it might be a social ideal to work in a partnership. It's much better to work in partnership than to work in opposition as a kind of social ideal. But in pure public health terms, the test of effectiveness has to be satisfied. And the test here is the greatest good of the greatest number of people. So I would say that that it's important to look at the hard-headed evidence for what actually is going to bring about that maximum good to the maximum number of people. And that is why I was saying in my kind of, I hope, challenging talk, which is, let us not be kind of imprisoned by dogmatic considerations, because the dogmatic considerations actually failed us at the moment of greatest need. So certainly as a person, certainly, what the coronavirus epidemic has shown us is that everything is up for grabs, including the very fundamentals on which public health and universal health coverage and the philosophies of health systems is based. And so we should be open to challenging and re-examining the foundations of assumptions on which we work. And I think this is not something that is going to happen in just one seminar or with one kind of a discussion, but it is something, it would be a wasted crisis, it would be a wasted pandemic if we simply emerged from it by returning to the status quo. Definitely, even if the pandemic was to be controlled tomorrow, going back to the traditional policies, traditional plans, and so on and so forth, I think would be a tremendous waste.
think the last question from Professor Mansoor Ahmad, my very good friend from Bangladesh, and then we will close.
Oh, good evening to everybody. Yeah, it was a very nice webinar. Thanks to all the speakers. And very nice to see Professor Thakur. I hope I will enjoy the attend the upcoming sessions also. Actually, my question, one of my question was what he told. I wanted to say that if we can control NCDs, we can. It will be possible to reduce the mortality from COVID-19. That's what actually I wanted to say, because in our country, in everywhere, what we have observed, the vulnerable group is the elder people and who have comorbidities with NCDs. So we can take care of the NCDs, then we can reduce the mortality from the NCDs. That's what actually I want to say.
So thank you very much, Professor Mansoor Ahmad, because we have discussed this issue also earlier, and the point which you are making is important. So I think we have already overshooted the time. So on behalf of World NCD Federation and all of you, I take this opportunity to thank Professor Mukesh Kapila and Dr. Chandrasekhar Potkar for being with us. And I think it was wonderful talk and a very stimulating discussion which we have. And I also take the opportunity to thank all the participants for this important webinar. As I mentioned in the beginning, that we have started this webinar series, and every month there is going to be a webinar, and we will be announcing it well in advance. So if you have any specific suggestions, you can definitely drop in a email or a message to us. Definitely we welcome the suggestions that how we can make all these webinars more interesting. And from our resources, we also have this International Journal of Non-Communicable Diseases, which is available on COVID-19 and NCDs. So I also am thankful to our partner, Pfizer, Hapjon, and all other stakeholders in PGI. So once again, on behalf of the World NCD Federation, I take this opportunity to thank all the speakers, all the participants. And if you have any questions, please feel free to put on our Facebook, which is linked live, as well as on our website. And we will be very happy to respond to whatever comes to us. So thank you very much. And with this, we close this meeting.
Thank you.
Thank you.